Okay. This is Senate Appropriations, and we're continuing our testimony on the fiscal 2023 budget adjustments. And we're taking testimony now from the Department of Disabilities, Aging, and Independent Living. Although I think it's Disabilities, Aging, and Independent Living. So Dale, that's what we call it. And so we have the commissioner who is here, and you have some staff with you if you want to introduce them. Sure. And we have a new vice chair, Senator Perchley, and I think Senator Starr, you remember, and Senator Westman. So we will get started with your budget adjustment testimony, and if you want to tell us who's with you today.
Okay, great.
For the record.
For the record, I am Monica White, the Commissioner of the Department of Disabilities, Aging, and Independent Living, also known as DALE, and I am joined by Deputy Commissioner
Megan Tierney Ward,
and our Financial Director,
Bill Kelly,
and Principal Assistant,
Rebecca Silvernagle.
Okay.
Okay, great. I'm sorry, did you want to?
No. I was just thinking how long Bill has been.
I was just thinking the same thing. How many years have you been?
over 30.
That's not very close.
Oh, no, well, why don't we keep going, and we can start with your budget adjustment, which I gather you'll be working from this document.
Yes, that's a question. I can certainly work from this document, or I can work through the ups and downs, whichever you would prefer.
Well, this
document, I can pull that up as that.
Well, we've got the ups and downs sheet, but I'll leave it up to you.
All right,
you have planned to do it.
Okay, so I'll go with the document.
All right.
Share that here.
All right, so I think that's great, and I think we don't need to go through the description. This is background information. Senator Perchley, he's a very good reader, and he gets things. He's a quick study. So this is just a helpful summary of your programs and who they serve and so forth. So why don't we go directly to page 3, I would think is where we should start on the money.
Let's start with the money for the money people. Yes, so absolutely not to echo the overview of what we have in the first 2 pages, but really just to start with the baseline orientation that I like to do when I speak about really anything related to our department, which is our mission, which is to make Vermont the best state in which to grow old or to live with a disability with dignity, respect, and independence. And so that really does permeate what we do across all 5 of our divisions, across all of our programs, across all of the services that we aim to deliver for the people that we serve, and results in what our budgetary decisions and recommendations are. So with that, just level set, I need to say that out loud for myself to reorient. So starting at the top of page 3, we have, this is just a summary of what our total net increase for budget adjustment for state fiscal 23 represents. And it is a total increase for budget adjustment across all appropriations, across all funds combined, of $27.3 million.
And that is gross, so that includes a lot of Medicaid.
Correct.
So if we were to take all funds combined and just look at what's the state share, what is that amount?
So looking at the total, governor recommended of the 27.3, 24.7 is total commitment, and 2.6 is general fund. And much of that is budget neutral across the Agency of Human Services. And so I'll get into those by appropriation, kind of which is the which falls where. But so in that top section on this page 3, of the $27.3 million gross, 19.8 of that is net neutral across the Agency of Human Services. So it would not be an overall increase. And then the remaining items that we have here, which I think Ken and will speak to greater detail when we get to the appropriation level, is just over $1 million of general fund for startup costs associated with a high acuity skilled nursing facility contract agreement. And I guess I'll get into that now because it's at the top of the list anyway. But over the past couple of years, as part of our work for stabilization and revitalization and assuring that our systems of care across the agency are maximized and that folks are receiving needed services in appropriate settings. It was determined that a gap in our system of care was a skilled nursing facility that had the capacity to serve folks with really high acuity needs. So to include folks in the correctional system, to include folks with really highly significant behavioral concerns, that we really needed to do a targeted focus on that. And so we underwent a request for proposals process over the latter half of calendar year 22, and solicited bids from vendors to bring online this as a service in Vermont. I have to be a bit obscure with particulars at this point, in that we have not yet signed a contract with the selected vendor, so I can't give you specifics about who or where while that
How
is
many
in
bids?
that will be, I've got the notes here, but Megan, do you have that right off the top of your head?
Yes, I can speak to that. We were estimating about 75 to 100 people at the time we did the RFP needed that care. So right about that.
So, so the amount here that we have in our budget adjustment request of $1 million is associated with one-time startup costs for that vendor in procurement, fitting up of a facility to be able to provide this service. The next item that we have in our just general overview is an increase associated with the Agency of Digital Services.
Yeah.
You know that? Okay, we'll skip right through that. We have a $1.4 million, this is global commitment associated with public safety needs for developmental services and providing, I can provide.
Is that the Act 248?
Inclusive of Act 248, but not entirely limited to.
And committee, just when we're using that term, the department, there's some individuals who cannot be adjudicated of a criminal act because of their intellectual disabilities. And so they're not viewed as competent, and they're placed in the custody of the commissioner. And they are oftentimes in small homes throughout the state, oftentimes in a staff secure setting, sometimes with two-on-one supervision because of the public safety issues. So they tend to be quite expensive placements, but they cannot be incarcerated. They can't be brought to court and charged because a determination has been made that they are not competent. And so we have those that, for mental health reasons, that this has to do with.
So even if we had the beds that, like we talked about in the last testimony, they wouldn't be able to go there.
Oh, not these, no, these are adults. These are adults, and they are evaluated, and it's based on their competency, and so we've been focusing on the kids that are, where facilities might be located, but there are many of these homes throughout Vermont that are serving this population.
Right, and the amount that we have in here represents 5 new individuals who've come in under Act 248 or are projected to very soon come in under Act 248, whose needs are significantly more acute than kind of our baseline caseload costs for the public safety caseload, and recognizing that is a distinct pressure for those 5 individuals. So sharing that we account for that in our budget adjustment request is what that fund is. And then the next item is $400,000. This is associated with one-time costs for bringing online, and this is general fund, and this is costs associated with bringing 2 additional crisis beds on into our developmental services system through Upper Valley Services, which is an agency with serving Orange, Washington counties primarily, I believe, and the 2-bed locations are, one is in Randolph, one is in Roxbury, and the $400,000 specifically is associated with one-time fit-up costs for issues such as work on the foundations to get the buildings structurally sound. One of the buildings, it was identified shortly around the time of purchase that there was issue with mold. So that was a remediation that needed to happen. And the one-time costs associated with bringing those beds online was that $400,000 that's reflected here. And then the last item that we have on here is the $4.5 million amount, which is a cost settlement for the Vermont Veterans Home, which is the only state-owned skilled nursing facility that serves veterans in Bennington County. This is a regular process that occurs with the Division of Rate Setting based on settling to their actual costs, and it's reflected in Dale's choices for care appropriation as gross global commitment.
And most all of this, though, is federally paid for.
With the federal share, so
Yeah, it depends, but yes. Although you can't use that 400,000, which is to do some improvements those would be capital costs.
General fund.
So that would all be general fund.
Of the 27, almost 27.4, 2.6 is our share of that overall, so it's small.
Well, yeah, a lot of it's just moving. Some of that 27 million is how we're moving it, but the caseload that's being talked about, the developmental services, that population is either served by our designated agencies. So in our area, be Northeast Kingdom Human Services, or Washington County, but in some areas like in Orange, you've got a split, and you have the Carmartin, who's the DA mental health, but your DS services are provided by a different agency, and they're called specialized service agencies. So those are SSAs. So we have DAs and we have SSAs that we fund, and Dale would be funding the DAs that provide the services to the DS population, and then in some areas they're funding a standalone agency. And you said Upper Valley was
Upper Valley Services is
an SSA
for the additional 2 crisis beds. Yes.
Yeah. And they're an SSA.
Yes. So moving in, so that was the department overview as a whole.
And you have TBI,
I'm sorry?
you have your TBI.
Yes. But, okay, so scrolling down, catch up to, actually the first, so in the middle of page 3, Dale grants, so this is our adult services division's programmatic expenses that are not choices for care. And so for this, we have a request for $568,000, and that is a global commitment. One of the neutral AHS transfers, or neutral throughout the agency budget, associated with funding the support and services at home program, which is administered by Cathedral Square Corporation and providing, curiously enough, support and services at home for about, I believe about 5,400 primarily older, some Vermonters with disabilities, service.
And so is Nancy Eldred still involved? She was doing national consulting?
I think she's still involved at a national level, but Kim Fitzgerald is the chief executive officer of Cathedral
Oh, I
Square.
know Nancy, I left there a long time ago. I was just wondering if she's, I'm assuming still in this area of care. So it used to be seniors aging safely at home. And that's all I can remember. I'll never update it. It's etched into my brain, but support, say it again?
Support and services. at home.
Support and services, okay. So we keep going then.
All right, so then the top of page 4, already spoke to actually all 3 of these items. So the 716,000 is neutral across the agency, but that represents the cost for bringing those 2 beds online for 9 months worth of, as they came online in October. So that reflects 9 years of operational costs for those 2 additional crisis beds. And then the 400,000 was that one-time startup cost for those two beds. And then I spoke about the caseload pressure for public safety associated with these 5 individuals coming in with really extraordinarily higher expenses than what we see otherwise. So that is our developmental services appropriation.
Was that because public safety more people or just more
Is it 5
violent?
So it represents 5. Our systems, you know, they have folks come on and folks go off of services, which kind of off and on. But this particular caseload pressure over the past over this state fiscal year, 5 new individuals coming in who we've not previously served, who have come in with really extraordinarily
If you
acute.
look at 285,000 per.
Oh, yeah.
So that's what I was talking about. These are very expensive placements and they are in homes. And this gets us into a concern we have about level funding the system. We have operating costs, fuel costs, food costs, et cetera, which is done by the SSAs. But you don't need to respond to that. We just know that that's in the budget. So we'll keep going, but you can see what we're talking about. Those are very staff intensive placements.
24/7.
24/7 and sometimes 2-on-1. Sometimes it could even be more than that because of the individual.
We run into that like in Berlin at the state facility.
We do, but so these are long-term placements as well. So Andy,
This summer, I think I contacted you about somebody that was in Marshfield. Do you remember the mother was concerned? Is that one of those cases? Or do you, I don't know if
I
you
would
remember.
not be able to speak specifically to
That's
an
what that was,
individual
right?
situation.
So,
shall we keep going then? You can. Hope it was responded to. I did, speaking about situations and before we get to choices for care. And I mentioned it to the secretary and I hope it got down. I had a call from one of the owners of Lake Maury Resort. And they had an individual that the police had brought to the resort because she was from Massachusetts and she was picked up by the state police because she was driving the wrong way on the interstate. She was totally confused as to where she was. She'd been 2 nights in her car along with her dog, who was very thirsty. And the police said, this is the end of our responsibility. They've taken her to a hotel. The ambulance service said there's no point in taking her to the hospital because she doesn't need hospitalization. So they were confronted with this elderly woman who that they had, what do we do? And I guess if anybody was fortunate, it was she was taken to a resort that they cared a great deal. They looked at her phone, they determined the neighbor, they called the neighbor, they found out where she lived, they fed the dog, they took care of her, they made sure she didn't get in her car and drive off to God knows where or create an accident or hurt somebody else. One of the staff people were going to a funeral and near where this lady lived. And so they drove her car back and they took her there and the neighbor arranged for Adult Protective Services in Massachusetts to be there to take over. And the owner of the resort said, there's got to be a better response than having a disoriented elderly person brought to a hotel and say that is the end. And it's true, it wasn't a law enforcement need once they got her off the highway, but it really needed a social service response. And so I'm bringing it up because it raises the concern that as we have more people, and I know we have the silver alert concept, well, sort of.
We don't
But,
have, I introduced it. We couldn't get it through.
But my point is, there's got to be some kind of protocol between law enforcement and some part of a protective service entity that could do the work to make sure that the public is protected, but a vulnerable adult is also addressed. And so this needed a social service response. It didn't need law enforcement. And I don't know if perhaps the state police, if there's a protocol. It appeared that there wasn't. They just said this was the end of their responsibility. They called the barracks to confirm that. And I'm just putting it out. I expect this can happen more. I mean, it could be me out there. I don't know, driving the wrong way. So my only point is.
It wouldn't be you right now.
All right. No, not today. So my only point is, it seems to me that this is a situation that we need to think about is, what do we do? What should law enforcement do? What is the appropriate response? And I find it hard to say that the only thing we can do is take her to and hope that the goodwill of wherever you took her would take over. And it was an extraordinary, very humane response that Lake Maury provided to this woman.
And the dog. I
And
think
to
that's
the dog.
remarkable. Yeah,
I
it would
know.
only happen in Vermont. But now you're moving into policy, and I think maybe there's a little paragraph that Senator Weston can put together for my committee when we take up the adult protective services.
Well, we need
bill.
something that is a protocol.
That's what I'm talking about.
I would say, you've tried. Every time we tried to do something like a silver alert or anything like that,
But this wasn't as though a family member is calling to say, I'm
No.
reporting someone missing. This woman didn't have any family. And so you really needed to have the protection of an agency to intervene.
Just couldn't
And so
name
I don't expect you to respond, but it just seems like we've got to think about the fact that this could happen more frequently as we look at our aging population. And And I think the proper response is the one Lake Maury gave them. But as Mark Avery said, that's kind of an expansive definition of hospitality. And I had to agree with him. But I'm glad she ended up where she did.
Should
So
we send him a thank you?
we should send him a thank you
Yeah.
note. I just wanted to bring it up as something I really think we need to address, and maybe Health and Welfare will have some funds.
My little hamster is running around and now I've got Senator Westman's here.
I'm happy
So this wasn't, as I say, it wasn't as though somebody is reported missing, and which can happen. I mean, someone wanders off and, whatever. This was someone who was actually presenting a risk to the public and needed help. So,
Thank you for sharing that really poignant story, Madam Chair. I think not to get bogged down in that policy item here, I will say that at the agency level, the Agency of Human Services, along with the Department of Public Safety and Commissioner Jennifer Morrison, along with our leadership throughout AHS, have been working very closely on a number of public safety enhancement initiatives. Actually, KeySet, the public safety enhancement team. And for Dale, we have participation on that group from our developmental services side for our public safety specialist sits on that group, as well as our adult protective services program director sits on that group. So that would seem a good vehicle for work on that front.
well, then I'll let you take it from there. It seems to me it's just a matter of what should be the right protocol, what steps should we take. And so I won't pursue it any further. It's, you obviously know, and I think it's a good topic of further discussion. So now we're down to choices for care, which is obviously a big ticket item here.
Just making sure that I speak to the brain injury program caseload utilization increase of funding for 6 additional persons coming into services represented here. And then, so yes, moving into choices for care. The first amount that we have on here is $7.6 million, and that is associated with choices for care carry forward plan from 22 into 23. And including, so that is comprised of 3 separate items. So that 7.6 includes a statutorily required 1% reserve in the amount of $2.3 million. And includes $4.2 million of emergency financial relief obligations for 4 skilled nursing facilities, and $1.1 million of state fiscal 22 reinvestments obligated in state fiscal 23 expense. So all of those 3 items roll up into the $7.6 million amount associated with choices.
So is there an increase for adult days?
I'm sorry?
Are the adult days here in your budget adjustment request?
No. And then the next item that is here in the choices for care appropriation is $1.1 million associated with skilled nursing facility medical director grants. And that item is late, or about midway through calendar year 22, a handful of skilled nursing facilities in multiple locations of the state through for multiple reasons lost their existing medical directors, physicians providing that medical oversight for the facilities. And that represented a pretty significant it goes as far as to say emergency situation. If we hadn't stepped in to help these facilities procure on an interim basis locum tenens physicians to serve in that role while longer term solutions were sought and implemented. So for that purpose, we stepped in to fund those grants to those facilities for $1.1 million. It was outside of the scope of what a normal financial relief through rate setting would accommodate. So that is what this represents.
Yeah, Senator Storm.
Yeah, I'm wondering, does item 2, that skilled nursing, does that have anything to do with the nursing staff leaving and going like as a visiting nurse someplace, and then the entity having
This would
to.
be a medical.
The medical director. So this item is not associated with that particular where traveler nurses are often employed
So
at.
does this position have to be an MD
Yes,
under licensing requirements?
yes.
Okay.
Is that federal law or state law?
I believe that is federal law.
Federal law, that's what.
So,
Because, MDs are visiting,
mhm.
and so,
So is my dentist from Montreal. So, yeah.
well, at least it's within the 2-hour, 3-hour driving time.
All right, so that's a position. Let me, yes, go ahead.
Yeah.
Where are these facilities located? Is this all over the state? You're seeing your medical directors?
For these particular ones, Franklin, so Chittenden County, Franklin County, Orleans County, and I believe Caledonia County, for the grants that we provided for this purpose.
Any retired physicians?
I'm sorry?
Are there any retired physicians who came back?
We have, so in one case, kind of quasi-retired, actually two. So for some of the longer term solutioning, we've been working very closely with the ACO, with One Care Vermont, with, in some cases, UAM Medical Center, with the Vermont Healthcare Association, and other involved parties to figure out, like, how can we, from a longer term perspective, stabilize this? Because we need to assure medical director services as well as physician coverage in this setting is critical to make sure that it's.
Well, we know
that's-
nursing homes are in very fragile state. And we know that from our hospitals that obviously patients are backed up in hospitals because nursing homes don't have the staffing to accept patients. So it puts pressure throughout the system. And we had some language around looking at reimbursement. I assume that might be number 3.
So number 3 is represents carry forward from 22 into 23, and this is neutral across the agency budget to include, to assure that we are able to fully fund the emergency financial relief requests that have come in, and that is primarily skilled nursing facility contracted nursing staff. So the $9.3 million to cover those emergency financial relief payments to skilled nursing
We have
facilities.
some language in the budget, didn't we, about looking at doing some adjustments to rate setting and overall reimbursement because of the base year being 2019. And so just like the PNMI discussion we had earlier,
That started in the budget adjustment last year.
it did. So I'm just wondering what has happened with our rates. I mean, rates are very different than emergency relief. Emergency relief means you get brought to the brink, and that creates a really very difficult fiscal environment. So this is not a function of a rate adjustment then.
No, this item in budget adjustment is not.
Is there some way that we could adjust that so that Medicare or Medicaid would cover a bigger share of that cost?
Well, that's what rate setting's designed to do, but it's based on cost, and the last, it's done periodically, but the base year for current rates is 2019. Well, you think about workload costs, and so that's what I'm asking is what might have been done to recognize the inadequacy of the reimbursement in this environment.
Madam Chair, I can try to answer some of that. Yes, in BAA from last year, the rate setting was asked to look at the method and how they can better support facilities to account for the nursing costs. So they did that, and for state fiscal year 22, there was a pretty big retroactive adjustment to address a disparity in the inflationary factor for
Was
nursing
that ongoing?
services.
That was an
That was for state fiscal year 22, and I'm gonna be honest, I don't quite understand how that gets carried forward in their rates, so I can't really speak to that. And they also foresee, because they don't get a schedule of financials from facilities until later in the year, and that just happened like in December. They're better able to predict the upcoming, because they are going into a rebase in July.
Well, that should be quite a ding on the FY 24 cash register. That rebasing, considering the fiscal environment currently compared to the last time that the rates were set. Okay, and then we're down to the veterans home, which we've already covered.
Okay, I recognize we ran a bit over, so I don't know what you have next on your agenda. But happy to,
I think, no, I think you're the last for the day. The only thing you're competing with is people's commutes.
oh gosh, well, look at the snow outside. Let me not get in the way of that.
Thank you.
Yes, thank you so much.
Thank you.
You've had a long day.
It has started out with.
Started with us.
You don't start those. Probably don't start until no.
Probably not sharing.
So, get the public safety and it's, well, now